What is GAVE? I know it sounds like a mysterious acronym, but fear not, I'm going to break it all down for you. Hi, I'm Dr. Desmond Chee, a gastroenterologist here in Melbourne, Australia. GAVE stands for gastrointestinal angiodysplasia or gastric antral vascular ectasia. Yeah, I know, that's a mouthful. Essentially, it's a rare condition that affects the blood vessels in the gastrointestinal tract. These blood vessels become dilated and can form abnormal connections between arteries and veins, leading to bleeding and other complications. This condition primarily affects the stomach and intestines and can cause symptoms like abdominal pain, nausea, vomiting, and most commonly, gastrointestinal bleeding. Now, you may be wondering what causes this condition in the first place. Well, the exact cause of GAVE is still not fully understood, but is believed to be related to the changes in the blood vessels due to aging or chronic conditions like liver diseases, autoimmune conditions, or chronic kidney diseases. Certain medications such as non-steroidal anti-inflammatories or NSAIDs can also increase the risk of developing GAVE. Genetics may also play a role in some cases. So how do you know if you have GAVE? The most common symptom is recurrent or chronic gastrointestinal bleeding, which can manifest as dark tarry stools or vomiting blood. Some patients may also experience abdominal pain, weight loss, and fatigue. It's important to note that not all patients with GAVE will experience symptoms, and the severity can vary from person to person. That's why it's crucial to see a gastroenterologist for an accurate diagnosis and appropriate management. Diagnosing GAVE can be challenging, as the symptoms can mimic other gastrointestinal conditions. Your gastroenterologist may perform a series of tests, including an upper endoscopy to visualize the blood vessels in the stomach and intestines. They may also order imaging studies like a CT scan or an angiogram to get a better look at the blood vessels and assess the extent of the condition. In some cases, a biopsy may be necessary to rule out other causes of gastrointestinal bleeding. Now, let's talk about treatment options for GAVE. The primary goal is to control gastrointestinal bleeding and improve the quality of life for patients. This may involve minimally invasive procedures such as endoscopic therapy, where the abnormal blood vessels are cauterized or treated with laser therapy to stop the bleeding. In more severe cases, surgical management may be necessary to remove the affected portion of the stomach or intestines. Your gastroenterologist will tailor the treatment plan to your specific needs and monitor your progress closely. The prognosis for patients with GAVE can vary, depending on the severity of the condition and how well it responds to treatment. With proper management and follow-up care, many patients are able to lead normal, healthy lives. However, complications like recurrent bleeding or iron deficiency anemia may require ongoing monitoring and adjustment to the treatment plan. It's important to stay in close communication with your healthcare team and follow their recommendations to optimize your outcomes. If you suspect you may have symptoms of this condition, don't delay seeking medical attention. Early diagnosis and treatment can make a world of difference in managing GAVE and improving your quality of life. Note, this video is not a medical consultation. Any medical information is general in nature and is not intended to provide individual clinical advice. You should contact your doctor or other healthcare professional in relation to any concerns they may have, as your own circumstances may be different. If you'd like to learn more or book a consultation, visit our website.